Findings indicate that the virus that causes Mpox, formerly known as monkeypox, was first discovered at the end of 1950s, but the first reported case of its transmission to humans was in the Democratic Republic of the Congo in 1970. Though the zoonotic disease is named after a monkey, it is important that people should know it actually has very little to do with the animal. Facts have evolved that Mpox causes flu-like symptoms, skin lesions, and can be fatal, with 4 in 100 cases leading to deaths.
Then we have the clade 1 and the clade 2 types. What Nigeria has, or what is predominant, is the clade 2, also known as it used to be called the West African clade, mode of transmission between humans and human to human transmission, predominantly in Nigeria. You also have the animal to human transmission, and yes, in some instances you can have environments to human transmission.
Because of the current circulating strength now, we also encourage every individuals to also ensure that they maintain a healthy sexual partners, because one of the modes of circulation is through sexual intercourse. Again, when you have any symptoms like fevers and then you have headache and fatigues, we encourage everyone not to do self-medications. Report immediately to the health facilities, and then the appropriate care will be given to you. Again, we also encourage every individuals that when you are eating bushmeat, it has to be properly cooked.
We have to resume our basic hygiene practices that we have thrown out after the COVID, like washing of hands, wearing of masks in some cases, avoiding crowded areas.
With the disease already declared a public health emergency of continental and international concern, scientists are worried about how fast it is spreading.
As we know, it's an exceptional level of alertness where some kind of international coordination is required, and the countries should step up surveillance measures. And of course, Nigeria is not high risk, it's moderate risk, but we need to continue to remain vigilant.
These Nigerian epidemiologists have been following the developments, and they tell me about the series of national responses, especially strengthening surveillance across the country and entry points.
We established our incident management systems. We did our incident action plan in terms of what we're going to do for action, and how it's going to cost each area again, using the different pillars. And also we've met with the state governments and the state commissioners of health in the states, basically to let them know that at the subnational level, they themselves have to establish their own emergency preparedness and response teams and capabilities and action plans, which we do with the support. And they are going to do that too in conjunction with their various local government areas. The essence is that the problems again are at the subnational level. That's what. That's in terms of coordination and incident management system.
Nigeria has always intensified surveillance. I've told you that since 2017, we have continuously reported confirmed cases. Luckily, we've been in touch with very many African countries before now, and so it will be important for us to, enhance surveillance. We're doing that also with the Port Health Service to be able to screen persons on our land borders.
From coordination, we have been able to bring up partners and stakeholders together using one net approach. And again, we have been optimizing our laboratories to ensure that we pick all cases and then we test them. Of course, we have been providing resources to the state in terms of sampling materials and then others commodity to support response.
In the Mpox epidemiological summary of the Nigerian Center for Disease Control and Prevention, Nigeria has no record of deaths from Mpox, but a total of 40 cases have been confirmed out of 830 suspected ones